Good morning, good afternoon, and good evening to all of you. My name is Marty van Lieren, and I'm the program lead of the Healthy Mothers, Healthy Babies Consortium, which is hosted by the Micronutrient Forum. The consortium aims to drive collective action for improving maternal nutrition and specifically to accelerate the introduction of MMS, multiple micronutrient supplements, in settings where diets are poor, indicators of maternal malnutrition are high, and where we believe that MMS can have a significant improvement in maternal nutrition status. Today is the 7th and the last of our series of coffee and chai chats for this year. This series was held with experts around various MMS-related topics. But before I introduce our last guest, today's guest, I would like to quickly take you through the format of the chat. So first, the guest will have about 7-8 minutes to introduce his topic. This time it is about experience with MMS in Bangladesh, notably through the distribution through private sector pharmacies. During this presentation, all your mics of the audience will be muted. After the introduction, we will unmute you so you can ask questions and carry the discussion forward. You can either write your question in the chat box and we will pose it to the speaker, or you can raise your hand when you would like to ask the question yourself. Please keep it short because we have a very dense and short time for this chat, so we would like everybody to get a chance to speak. Once you're called upon to speak, unmute yourself and then again mute yourself after you're done. That will help avoid the background noise interfering with the discussion. I can see that most of you have written your name already in the chat. If you haven't, please do so we can invite you by name and we also know who is on the chat. And then our total time is 30 minutes, so I should be silent now. And I should give the floor to our speaker. One last thing, if you have any technical difficulties, please also type this in the chat and we will have somebody try and answer this. Now, today, I'm very pleased to welcome to our coffee and chai chat, Mr. Toslim Uddin Khan. Toslim is the Deputy Managing Director at a social marketing company, SMC, in Bangladesh. SMC is, I believe, one of the most successful and largest social marketing programs globally and a significant contributor to the National Health and Family Program in Bangladesh. And as so many social marketing programs, I think SMC initially focused on family planning services, but over time they have expanded to nutrition services, including micronutrients tablets for children, zinc tablets for children with diarrhea, and now also multiple micronutrient supplements for pregnant women. So today, as I said, Toslim will speak about his experience in Bangladesh with the distribution of MMS. And Toslim, I'm so delighted that you're here with us. It's quite a late hour for you already, and I'm looking forward to a stimulating discussion. The floor is yours. We cannot hear you. Please unmute.
Thank you, Marty, for your brief introduction and nicely presenting me. And it is a wonderful opportunity for me. And special thanks to you for sharing our experience with our esteemed colleagues. So we welcome everybody and greetings from Dhaka. So I am sharing the screen now. So can you see the?
Excellent. Yes, thank you.
All right. All right. So this is, we are a social marketing. Marty nicely introduced about the social marketing companies. The social marketing company, just in one sentence, is one of the successful model of social marketing across the globe. And it is a great contributor in health and family planning sector in the country. Social marketing company, the next slide. Okay, and the social marketing company use a public platform and pharmacy coverage across the country. We work with mostly four network. One is the Blue Star network. Blue Star network is a network with a non-graduate medical practitioner to offer the contraceptive injection and other public health priority services. And each of the Blue Star network, each of the Blue Star provider, a pharmacy is attached with them. So we have 9,000 that type of Blue Star providers and Blue Star network. And then the Green Star network is, they are mostly drug seller, and we have around 4,300 Green Star network, Green Star provider with us. And then the Pink Star, they are mostly gynecologists, and they offer IUD and implant services. And now we are actively thinking to include them for offering MMS services, MMS product, prescribing MMS product and promoting MMS product through them. And then the Gold Star is a rural entrepreneurs. They are also disseminating health information and sell public health products. And we have a huge distribution channel. First of all, we have central warehouse, is a state-of-art warehouse for warehousing the products. And then we have 12 area sales office, and which is attached with area level warehouse. And then we have 200 sales force across the country, the strategic location of the country, so that we can cover the whole country, and 120 field program staff to implement the program activities. And through this effort, we reach 148,000 pharmacies and 519 grocery shops across the country. So these are the network which enable us to be market leader for oral contraceptive pill, for condom, injectable, and also our Ursaline SMC is also the second market leader of sanitary napkins. So all the public health product and services we used to distribute through this channel. And now we have started with our MMS brand, MMS as a full care brand. Full care is the first ever product in the Bangladesh. Perhaps it is not in the Bangladesh, but across the globe. I mean, we have started MMS. We have launched MMS and at the rollout MMS at the national level first. And this is, if you see, we can see in the picture that the dispenser and the packet and the blister pack of MMS. I am sharing with, this is the way of the pack we have, and also we have dispenser. Just to give me a dispenser, please, so that I can share with my colleagues. And 6-pack we keep it in this dispenser, and there is a I mean, we can keep out, tear it this place and keep out. So we can keep the pharmacy in that way, so that, I mean, it become visible in the pharmacy. And then each our maximum retail price is $8.5 for 180 tablets. It's a full course of pregnant mother. Our preferred dosage is starting from identification of the pregnancy up to the end of that pregnancy. So it is in most of the cases it is 118 tablets. So that is our suggested doses for them. And shelf life of this product is 2 years. Then I mean, how we have started. The first of all, we did extensive literature review. Whatever the available literature, the beginning we reviewed it to get the adequate information about the MMS, and then we thought that a KAP study, knowledge, attitude, and practice study, will be giving us some level of insight through which, I mean, we can start the product. So we have done this study, and we reviewed it, we conceptualized it very extensively. And then not only this CAP study and literature review, we have all the pack, even you are seeing the blister pack, then the secondary pack, then dispenser, everything. I mean, we went through a process of pre-testing with the providers, pre-testing with the users, so that we get the best on. So we have done that. And for pricing related things, I mean, we had a quick willingness to pay study as well. So always, I mean, we took an informed decision, and still we are doing that so that we can get the adequate understanding about this. The initial result, I mean, before that, I want to acknowledge that our prominent pharmaceutical in the country, Renata Limited, is our production partner. They are supplying this Full Care. Our brand is Full Care, but they are supplying on behalf of us. And then Gain is our prime partner and technical partner. And we have started that in July 1st, and so far we have sold 3.8 million tablets, which is very encouraging at this point of time. And it is across the country, 71% rural area and 29% urban area. And also all the division, 8 division and 62 districts. The country has 64 districts. 2 districts we have kept for UNICEF and GOB pilot testing for MMS, and we are covering rest of the 62 upazilas. And within this short time frame, we have almost covered 1,500 outlets, and 54% of them in our network. If we consider sales, then 60% and more than 60% sales is coming from the network. Our Blue Star, either Blue Star or Green Star or Gold Star network. And outlet, the repeat purchase, one of the indicator of success. You know, the second time they purchase or third time purchase, already 27% outlet purchase repeatedly. So lesson, within short time we have learned some lesson. Initial response of the providers and consumers are very, very positive. We are very much optimistic about the product, about the MMS, and we have observed that OB-GYN is very critical for success, and we have made the product available across the country, and now we are contacting with gynecologists so that they can, if they write prescription, that will be very useful for us. And favorite policy document, you know, we have conducted a lot of TV talk show, and I participated in many cases. Line director, NNS, National Nutrition Services, is also participated with us, and it is a congenial atmosphere. We are saying Gain was very much instrumental to ensure the congenial atmosphere, and all the policy level approval and government approval we have received to carry forward these activities. And orientation of the providers, our Blue Star, Pink Star, and Green Star providers is very critical. So we are doing that regular. But one thing, since it is drug, there is a regulatory barrier for mass media campaign. But we are thinking the top below the line. Let us start below the line, and then we'll be going mass media later. But the TV talk show, we are doing a series of TV talk show to sensitize the relevant stack, and that is working well. So that is the lesson we have learned. I want to stop here because let us give much more time for discussion and question and answer, so that we can get adequate understanding about within this half an hour. Thank you very much.
Well, thank you very much. And the first question is already in, and actually it's the same as I wanted to ask. The 3.8 million tablets that were sold is very impressive, but do you also know how many women have been reached so far? So how many clients or purchases have been there?
That's a very, very good question. You know, this is a market approach. Anybody can come and pop in the pharmacy and they can take their supply. So we are not, it is even perhaps it's not possible to write the name of the particular pregnant mothers who are purchasing that, but we will be collecting some level of information. We will be starting with that, but initially we can guess that these 3.2 million these 3.2 million means that about 100,000 blister pack. These 100,000 blister pack contain with 3 blister pack contain on pack. So on pack is a basic unit. So if we consider,
so can I ask you how many tablets per blister pack?
10 tablets per blister pack.
Right.
So then we can assume that it is maybe 200,000 pregnant mothers they have. That is my assumption, but it is very close to reality. 200,000 pregnant mothers they have purchased the product meanwhile.
And is SMC or maybe one of the partners like GAIN, are you trying to measure the compliance of the mothers? So I understand that, you know, when the pharmacies, you cannot always check who is buying what and how they're using it, but is there any kind of implementation research that is looking into this?
Yeah, compliance is a very, very big issue. I mean, whenever we are providing training of our Blue Star and Green Star provider regarding MMS, so that they can counsel the clients or pregnant women appropriately that they should take, their doses and how they will be taking. So it will largely address by this. Another way is we will be also doing some promotional campaign where the complaints issue will be addressing. That is the second thing. And third thing is ICDDRB is also our partner, and ICDDRB will be conducting a study to see the compliance level of the among the mothers. So compliance is very much critical part of our consideration.
Thank you. So that actually the last part means that the ICDDRB, which for those who don't know is the international, well, let's not say, but I don't think they use that name anymore, but it's a large research institute in Bangladesh. So they are doing a study to measure compliance. And well, when will you have the results of that study? How long will that carry forward?
Yeah, we have a midterm evaluation in plan. So we will be doing that, and then we'll be getting information, and based on that, we'll be doing some correction process as well. So that is one thing. And also we will not sit, we have our Telejigyasa program. Telejigyasa program is, we have developed a software. That software will allow us that the end user, pregnant woman, we have a connectivity with the pregnant woman. In what we will be doing is, in the pharmacy, we will be writing a name of the pregnant woman and their cell number that will be entered in the software, and then we'll start conversation with them, interaction with them, and giving some information so that they can ensure compliance. We will be periodically sending SMS to them, and also we will be have interaction, and through this process we will be also learning the compliance process as well.
That is great. And when is the midterm evaluation taking place?
That we will be thinking 1.5 years later.
And half a year? I'm sorry, I didn't hear.
1.5 years later.
Okay, so 18 months after the start of,
yeah.
So you started in the summer.
Yeah.
Okay, good.
And before that, we will be the software we have developed. That is the excellent way of interacting the consumers and among us. So we will be getting information about the compliance.
Thank you. There's a question about, and I don't think you know already, because this is all relatively new. Distribution started over the summer, but there's a question that says, is the coverage higher with paid tablets compared to free tablets. Now, I don't think you already have those data, but is it foreseen to do that comparison, looking at coverage and comparing the distribution of the MMS through the pharmacies versus the distribution through maybe the public health setting where the tablets are free?
To be honest, I mean, the two districts we have kept aside for these activities, but they haven't started yet. Perhaps one of the issue is getting supply from where they will be getting supply. So we have faced a lot of issue initially, a lot of effort we have given so that we can get it. Get necessary approval from drugs. So that's the one thing. The second thing is when it will be coming. Our experience over the last 45 years, the oral rehydration salt, there is a free and hours on is overwhelming because it is widely accessible for all the pharmacies. Our oral contraceptive pill, 47% of oral contraceptive pill is from our brand, although there is a free distribution across the country. Then 58% condom is ours, also there is a free distribution. So it is a different, it's a power of promotion, power of branding. It's a marketing different approach. I mean, maybe one of the cost they consider that if they go to the government providers, it's travel and others and expending time and going to them. Rather, if they go to pop in a pharmacy and they can collect their supply easily, perhaps that is also another way of thinking easily. I mean, and another thing is that country's economy is growing. So, we don't think, considering the ORS, the before ORS, popularized ORS, diarrheal disease was #1 killer in the country. And now is 6th or 7th due to our magic box sachet or saline ORS. So similarly, we are thinking that when we will be promoting this product, we will be making it available and accessible the doorstep of the clients. I mean, through our pharmacy network and our own Blue Star, Pink Star, and Green Star network, then the consumers will feel free to use that, and it will be getting momentum.
Yeah, I totally agree with you. I think it's really interesting that Bangladesh is simultaneously, or more or less simultaneously, testing both a public and a private sector approach. I think they're very complementary. And maybe you have lessons from MNP's distribution to children, the paid distribution versus the free one. I am, however, asking another question because that one is first. Siti from Indonesia is asking, what are or were the regulatory issues that may prevent social marketing of MMS? Did you have to overcome regulatory barriers?
That's true. I mean, there is a very, very stringent, Bangladesh Drug Authority is very, very visible. And for these products, I mean, the regulatory requirements are after there is a 6-month stability test. And then after the 6 months, there is a two segment. One is a technical committee. Then we had to, I mean, Renata did on behalf of us, and we have given, and GAIN has given, Sight and Life has given all necessary data and information. And with them, Renata applied for registration, and then technical committee passed it through. And then periodically, once in 6 months, National Steering Committee, they sit, and then this national committee, they approve. So there is a lot of, stringent process we had to pass through. And this is for DG drug approval. And each of the promotional item, again, we need to go back to the either DG drug or there is a IC technical committee. So then they give us. But the thing is that once you get approval, it will be useful. You can go ahead and do it. But we respect that because, I mean, we also want to ensure the compliance and quality of the product. And we want to ensure that it is under the regulatory authority and duly approved by the government machineries.
Mhm. Is MMS already included in the national essential medicine list of Bangladesh or not yet?
The direct answer is not yet. But yes, I mean, in government, there is a 4 or 5 policy document where MMS is included. You know, here,
Yeah.
GAIN played a very, very critical role to make it happen in the policy document, included in the policy document. And the line director, I mean, who is the really implementer, line director of NNS, National Nutrition Survey, he's very supportive. So it is a part of the government policy now.
Mm-hmm. Thank you. Now, there's one question that's highly technical, and that's actually asking about contraceptives that are being distributed. Because the reason we have MMS, well, it's the reason we distribute MMS specifically in settings with high anemia and low maternal nutrition rates is, of course, for anemia reduction purposes, but also for better birth outcomes. But the question that has been asked is, well, is there anything else that's being done to control menstrual bleeding and the associated anemia with that? So that we're not only using MMS to let's say prevent anemia, but that we also use other contraceptive uses to prevent anemia. And so so basically, is iron status taken into account in the selection of the contraceptives, etc. And I don't know, Hans, you asked the question if you want to be more specific, but otherwise I'll give the floor back to Dr. Khan. Do you understand the question, Dr. Khan? Are you?
I partially I understood. I mean, what is the question is whether any spotting or any other anemia is contraceptive. For example, oral contraceptive pill, also supplementary iron is there for 7 tablet. So that is the way in the national program also some level of contribution for anemia reduction. But here I can tell another thing. Recently there is a national study, and national study, it shows that national study of micronutrient among the 15 to 49 years women of the country. Ironically, we received the information, it is done by the government as well, and others partners are included, that 50% of the mother, I mean women, are suffering from deficiency of zinc. About 2/3 is suffering from deficiency of vitamin D. Iron, about 1/3 is suffering from iron. And iodine is another 1/3. That type of deficiency is there. So that's why we this MMS is a comprehensive approach to address the micronutrient deficiency of the pregnant woman, because when the mother becomes pregnant, the problem is much more acute. So that's why.
I agree with you. I think that was not exactly the question, in the sense that we all know that MMS is there to address also the other micronutrient deficiencies, and actually has an added value over iron tablets, that it also improves birth outcomes. But here the question is really related to anemia. Hans, I can see you have your mic off.
Yeah, sure. I think you can hear me?
Yeah.
Yeah. So I think my question is not so much whether we should use MMS versus contraceptives. The question is, if contraceptives are handed out, is that also done with a specific purpose for controlling menstrual bleeding and its associated anemia, or is that only done for contraceptive purposes? And also, do you offer the levonorgestrel intrauterine device, which can reduce menstrual bleeding by 96%? Because it would seem to me that if you give MMS and you don't stop women from bleeding, especially the heavy menstrual bleeders, then you can intertwine these two interventions and make one more effective if you also offer the other.
Hence, thank you very much. If your question is associated with the pregnant mother, then IUD, it is. I could not understand the reality. I mean, what is the how I should answer. But one thing, IUD is not too much popular in the country. It is the IUD prevalence rate of the country is only 0.6%. So that is one thing. And another thing, when she will be pregnant.
That is, sorry to interrupt, but that is the copper IUD, I suppose, or not?
Yeah.
Because
that is a copper IUD. In Bangladesh, that's a hormonal IUD. Even this morning, I had a discussion with Medicine 360 because I mean, in Bangladesh, hormonal IUD they have not been introduced, but they are discussing with me the way how we can address it. So once they become pregnant, so there is no question of using contraception like IUD or any other method.
Right. And to come back to my the first question, are these things only offered to women because of their wish to plan families, or is it also done for women who have problems with iron deficiency anemia, and then they are offered contraceptives as a possible way to control that iron deficiency anemia?
Hence, this product is positioned for the pregnant women. When they're pregnant, then question of that time contraception is not coming. So that's one issue. Another issue is you are right that whether these MMS can be used by other members of the family. For example, adolescent girl, there is a lot of that's why I have shared this information regarding the micronutrient status of the country. So there is a lot of deficiency, they can use it, but our MMS, we have initially positioned it for the pregnant mothers because we want to, 28% birth is low birth weight in Bangladesh. Out of 128 become, their weight is less than 2.5 kg. So it is not we want to improve this situation. That's why our positioning is we have positioning this product for the pregnant mothers.
And I am going to stop this discussion, though it's highly interesting. I thought it was interesting to bring up the contraceptives, indeed, when we're talking about pregnant women. But I think the question was actually maybe more about the women that are not pregnant but have heavy menstrual bleeding. We can take that up another time, or Hans, I can put you into contact with Dr. Khan if you would like. For now, I think we have to close this. We're 2 minutes over time. I really would like to thank all of you, and specifically Toslim, for an interesting discussion. This was our last expert chat for this year. All the chats have been recorded and they are available or will be available through the Healthy Mothers, Healthy Babies website, Knowledge Hub, and also on the Micronutrient Forum's YouTube channel. Now, if you like this and previous chats, please join the consortium or subscribe to our newsletter. I also encourage you to look at the website, the Knowledge Hub that I already mentioned. And I'm especially excited about an upcoming new feature that is an interactive world map with all the MMS activities of nutrition partners across the world. Now, for today, I would love to wish you a great day, and hopefully we will continue this series of expert chats again next year. This is not the last thing we're doing of the HMHB consortium. There is a lot of work coming up also on women and maternal nutrition in a pre-N4G event on 30th of November. So please check it out. Thank you everybody for joining us today. Thank you for your questions and see you next time.
Thanks a lot.